Hi everyone, it's me, Dr. Whimsy, and today we are talking about drug supplementation interactions. Is there ever a time when it is dangerous to be taking a supplement, an herbal supplement or a vitamin supplement? And if so, can I talk a little bit about that? Well, there are a lot of examples, but I'll talk about some basic stuff and a little bit about me and how I came to be interested in this subject. After I graduated from medical school, naturopathic medical school, I went to work at a pharmacy, and I think that was a really great thing. I went to work for Pharmaca Pharmacy, and I had a wonderful time. I loved the company, and I loved the people I worked with, and I'm very grateful for that opportunity. Just want to say that. But I was there for about 5 years while I was building my private practice. One of the great things I learned when I was working there is I learned a lot about pharmaceuticals, and I learned a lot about drug-herb interactions. And I think it's really important for us to have that conversation, particularly since so many people are interested in uh, the, uh, the herbal medicines and they're interested in supplements. Many of the herbs that naturopathic doctors use have been used for a very, very long time to treat all kinds of health challenges. And in fact, a very large percentage of the medications that are currently on the market today were discovered originally from plants. I'll give you a couple of examples of that. One is the medication atropine. Atropine is a medication that's used to dilate the eyes. You put drops of atropine in the eye, it dilates the pupil so that we can see inside the pupil more effectively. Atropine was first isolated, I believe, from belladonna. And belladonna tincture was what women would put in their eyes, and their eyes would dilate. And then they would be called, they came to be called belladonna, the beautiful woman, because her eyes were dilated after she would put belladonna drops in her eye. So that is where we learned about atropine. Another really cool discovery was willow bark. Willow bark was what the Greeks would use to take away headaches. But when we look at it from a chemical perspective, we see that willow bark contains salicylates. Salicylates are aspirins. In the lab, we can make aspirin now synthetically or salicylic acid, and we use that to treat certain medical conditions. Salicylic acid is a class of medication that we call a COX-1, COX-2. COX-1 is a blood thinner, right? That class of medication is a blood thinner, and this is why we tell people to take a baby aspirin every day to decrease their risk of a heart attack, because it slows down how quickly we clot, and it could theoretically be used as preventative medicine. A COX-2 helps get inflammation down. It helps with the inflammatory pathway. So chronic inflammatory pain, people will take a COX-2. Like they would drink willow bark, they would get rid of their headache or any kind of aches and pains that they have. Or they would take a willow bark tincture. When does this become dangerous? Well, this is why you really want to talk to your doctor about any herbal herbs or supplements you're taking, because you can potentiate, theoretically, a drug that you're already taking. An example would be the person who's on Coumadin because they have an arrhythmia, they have an irregular heartbeat. And so the doctor places them on Coumadin to decrease their risk of having a clot, because unfortunately people who have an arrhythmia are at a higher risk of forming clots. So we want to give them something that's going to prevent that from happening, so Coumadin is sometimes prescribed. If that same person is taking herbs that contain salicylates, and many do, then they are theoretically potentiating their medication, and that can be very dangerous. So you really want to talk to your doctor before you're taking any vitamins or supplements, because you want to avoid those types of risk. Other herbs that contain salicylates, turmeric contains some salicylates. That's why we will often prescribe turmeric for chronic inflammation and pain. Ginkgo biloba has some blood thinning properties. and many others. So again, you want to talk to your doctor. Now, in terms of vitamin supplementation, there are quite a few things we could say about that, but here is what we know. We know that some medications that are prescribed and some medications over the counter can, over time, inhibit vitamin absorption. The most common example would be a proton pump inhibitor. A proton pump inhibitor can decrease the amount of stomach acid you have, and if you're in chronic pain because you have acid reflux, that's probably a good thing, but unfortunately it can also lead to some interesting side effects. Over time, for example, you might experience a decrease in your B12 absorption. It can inhibit B12 absorption. Some mineral absorption may be decreased as well. This is one of the reasons why we talk about supplementation with B complex, B vitamins in people that are taking a proton pump inhibitor. HCTZ, hydrochlorothiazide, which is a common diuretic that's prescribed for people who have hypertension or edema, can also sometimes lead to over or hypercalemia, too much calcium in the blood. And so if you are taking calcium supplementation, you want to go over that with your doctor if you're also taking HCTZ. So those are just a couple quick examples that I thought about over the top of my head about how I always want to talk to my patients before I prescribe any supplements or herbs about what medications they're currently taking. And it's certainly a conversation you want to have with your doctor. Herbs and vitamins are wonderful things, but you want to work with someone who understands drug-herb interactions and can help give you an effective treatment. If you are looking for a naturopathic doctor, you want to go with one that's gone to one of our 5 medical schools we currently have in the United States and in Canada. To find out more about that, I'll link below to the American Association of Naturopathic Physicians to find a trained naturopath in your area. I want to thank you for listening to this brief video on the potential dangers of drug-herb interactions. I want to thank you for watching. Be sure and share, like, subscribe, and I look forward to speaking to you again soon. Take care. Bye-bye.